pellets, creams, injections, oh my. You've heard of hormone therapy, but which method is right for you? It can all feel very overwhelming, and choosing the wrong method can leave you stuck, frustrated, or worse, still symptomatic. So today I am walking you through each hormone therapy option and what I recommend based on years of treating my patients with hormonal imbalances. Hi, I'm Dr. Bennett, Doctor of Nursing Practice and founder of Vista Wellness in beautiful St. Augustine, Florida. I help my patients rebalance their hormones, restore their vitality, and just finally feel like themselves again. In this video, I am breaking down the most common hormone delivery methods, and I hope that this can help you make a decision on which method is best for your body and your lifestyle. Now, why does hormone delivery method matter? Not all hormone therapy is made equal, right? And more importantly, it's how it is being delivered. And this is why. Your body absorbs hormones differently. Some people do great with creams and others absorb nothing, through creams. Some people like the consistency with pellets and others want to have a bit more flexibility to change your dose at any time. So that's why choice is not cosmetic, it's actually clinical. Now let's take a deep dive into the different methods. Method number one is hormone pellets. Pellet therapy is one of the most popular options that we offer here at Vista Wellness. It's a small implant, a bit bigger than the size of a large grain of rice that's inserted underneath the skin, usually in the hip area. So that description is for the female pellets. The male pellets are, a little bit bigger than the female pellets. Now, what are some of the benefits of pellet therapy? We are seeing steady and consistent hormone release, no daily upkeep. So compliance is a lot better when you're using pellets. It's ideal for busy people who want long-term balance and consistency. What are some of the drawbacks? It's a small in-office procedure every 3 to 5 months for women and every 4 to 5 months for men. I've had this question asked of several times before. Do you remove them and put new ones? No, we don't remove them. They go underneath the skin and it dissolves over that length of time, and then we place new ones in a different area. So there is some minimal downtime involved with pellet therapy immediately after insertion, and a little bit of activity restriction immediately after as well. And also, once the pellets have been placed, the dose cannot be changed. I always tell my patients there's no return policy on the pellets. Once you get them, they're in there and you've got to wait 3 to 5 months for them to dissolve. And if you want to change methods, we can do it at that time. But most people tend to stick with pellet therapy once they get started. Now, method number two, we have creams. We can get compounded hormones in creams to apply daily. Usually it is on the inner arms or thighs or behind the knees. Some formulations can be applied vaginally. So what are the pros? It's non-invasive, it's easy to start, and the dose can be adjusted easily. What are some of the drawbacks? It requires daily maintenance, so you have to remember to apply daily. So sometimes compliance is not as great because it needs to be applied daily. Also, it can transfer through clothing, to other people. So I don't recommend this method for people who have small children at home. And also, a major drawback is absorption through the skin. The skin is supposed to be a barrier. So anything that you apply on the skin is not gonna absorb, as well as if you put it underneath the skin. So with the creams, achieving therapeutic levels can take a lot longer than the pellets. The main thing is this is a good starting point for people who want hormone therapy and they just want to test the waters to see how that's going before they dive into a more long-term therapy. But this method is not really great for long-term. Some people who are disciplined and can be consistent, they do okay with it long-term. But most often we have our patients, they start with the cream and then they will switch over to the pellets. But then we have some who come in and they just want pellets right off the bat, right? Now, the next method number 3 is injections. Injections are usually given weekly or bi-weekly. I often use injections mainly for testosterone therapy, and it is one of the least utilized methods in my practice. Given that those synthetic hormones, again, I typically offer this option mainly for men. I don't do injections in women. And there are some pharmacies that are able to compound bioidentical testosterone to be given by injections, but this is not readily available most of the time. Now, the pro of this, the advantages of this method include fast absorption, so people can typically see results within a day or two of injection. It's great for people who really need a quick boost, and it's easy to adjust the dose. Now, what are some of the drawbacks? It can cause hormonal peaks and valleys. So you do have a lot of periods where you're feeling great and energized, then it drops really quickly before the next injection. So lots of peaks and valleys, and some people do not like that swing in their mood and their energy. It is not ideal for long-term therapy because, again, compliance is a lot lower since it is a bi-weekly injection. So this can work very well for someone who's disciplined and does not mind taking an intramuscular injection, but most people really do not enjoy getting an injection twice weekly. Now, there is also method number 4, which is troches. I don't really like troches in the sense that you have to place them in between your teeth and your gum and the inside of your mouth and allow it to dissolve over time. I would classify the troches and the oral preparations like pills and capsules in the same class. The only oral method of hormone delivery that I really like in women is progesterone, because that helps with sleep and it is the best absorbed method. So that is the only exception to hormone therapy that is being taken by mouth. So again, it's easy to use when you take it by mouth, but the drawback is just you constantly, especially for other methods like using troches by mouth or using estradiol, you also have to check liver function tests to just make sure that these methods are not affecting the liver. But I do not like the troches. I do not really like giving hormones like testosterone or estradiol by mouth. The only one that I prefer to give in capsules will be progesterone. So this is what I recommend in my patients and why. The best method depends on your lifestyle, your labs, and the way that your body responds to this hormone. So pellets are great for long-term consistency, no daily effort. Creams are good for beginners and those needing gentle entry into hormone therapy. Injections can give you fast results, flexible dosing, and only really good for testosterone. Troches are so. I don't really like them because you're not getting the best absorption, and then when you take things by mouth, you also have to monitor lab levels. So at Vista Wellness, we don't guess. We test and then we tailor the treatment according to what your body needs, right? So every patient's path is completely different. You deserve the hormone therapy that is actually going to work for you, your body, and your life. Again, what works for you, it is not what worked for my sister, what worked for my auntie, or for my mother. It's got to be what works for you. So book your personalized hormone consultation here at Vista Wellness. Call us at 904-800-4003 or visit us on the web at vistawellnessfl.com. Please like, comment, subscribe, and share this video with somebody in your life who's trying to figure out the next steps in their health. Everybody deserves clarity. I'll see you in my next video.